So like I said, there's two types of arrhythmias. There's bradycardias, where your heart's beating too slow, and tachycardias, where your heart is beating too fast. And today we're just going to focus on tachycardias. And there's many different ones, and we're going to see all of them. I'm going to show you how to differentiate all of them. So the first question you're going to ask is the QRS complex wide. Remember, that's greater than 120 milliseconds, or is it narrow? Once you've determined that, the next question to ask is the QRS complex regular or irregular. That means, is it coming at a regular time, like every 1 second or every 2 seconds, or is it coming in random spurts? And finally, once you determine that, you can look at the P waves and you can figure out your etiology. So let me show you how we do this. First of all, let's say we have a wide QRS. Okay, so that's, or you see your QS, it's greater than 120 milliseconds. What's the next step? Remember, the next step is this a regular or irregular QRS? If it's a regular QRS, you have your answer. This is a ventricular tachycardia. So you see in this picture here that it's wide QRS, wide, 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 and you see they're coming in regular intervals. Very regular. So that's ventricular tachycardia. And treatment will depend on the patient's hemodynamic status. You don't really need. First, let me also emphasize that you don't have to know this algorithm for step one. Step one, you just have to memorize the cardinal features. But this is useful in real life, and I think it might still be useful in step one. So next is, so we say we recovered a regular QRS. What if it's an irregular QRS? Well, irregular QRS will be an atrial fibrillation. Let's erase our pen markings. With Wolff-Parkinson-White Syndrome. So normally your atrial fibrillation has a normal QRS, but what happens with that Wolff-Parkinson-White Syndrome? Remember what we talked about? Remember, there's a re-entrant pathway that leads to early depolarization of the ventricle. Remember what this thing was called? Remember, that's called the delta wave. And that's this delta wave plus the QRS makes that QRS wider. But it's going to come irregularly. As you can see, this area is narrower than this area. So remember that atrial fib, remember what that cardinal symptom was, that it's irregular pulse. And every time you hear that, you're going to know it's atrial fib. Treatment here is, first you start with vagal maneuvers. So that's like Valsalva. You tell them to squeeze like they're having a bowel movement. Actually, no, you do some positional changes to them. And that's called that's also a vagal maneuver. The other treatment is you got to give them rhythm control. If they're unstable, that means their vitals are not looking good. They're super tachycardic. Their blood pressure is super low. They're symptomatic. Then you got to do cardioversion, which will reset the heart rhythm. So now we've covered wide complex QRS. So let's look at narrow complex QRSs. Let's erase our markings. And now we have a narrow complex. Let's say it's regular. So the next step is, there's multiple regular narrow complex QRS. So the next step is to look at the P waves. So if you have a P wave before every QRS and a QRS after every P, that's called a sinus rhythm. This is a sinus tachycardia. So there's no underlying circuit abnormality. It's just your heart's beating fast. It can be beating fast because you've just finished exercising. There's many other things you can, if you try to think about it. It's going to be pain can cause your heart to beat fast. Anxiety can cause your heart to beat fast. But note that it's a sinus rhythm. It's a regular rhythm. So P before every QRS, P before every QRS, QRS after every P. And the treatment here is you treat the underlying cause. So if they have, if they're in a lot of pain, you give them pain medications, blah, blah, blah. Now, again, so we have narrow QRS, regular rhythm, QRS. The next one is if you have absent P waves. Absent P waves is a supraventricular tachycardia. That's a tachycardia that's coming from above the ventricles. And the treatments for this is, again, vagal maneuvers. That's that positional stuff that you do. You can look it up if you want. I'm not going to explain it. And then you can try adenosine. Adenosine is that drug that it works great, but gives you that impending sense of doom, like you're going to die or something. So you always want to warn your patients about that. And then rate control. Rate control is either a beta blocker or a calcium channel blocker. If this patient is stable, we said, remember, if the patient is unstable, How do you know a patient's unstable again? Remember I explained that to you. That is if their vitals are all messed up and super scary, if you're afraid they're going to die, or they're symptomatic, like they're having dizziness and stuff, you got to cardiovert them. Cardioverting is just resetting their rhythms. Next, if you see sawtooth P waves, what was that? Remember what we talked about? Remember that was atrial flutter. So again, these are all narrow QRS, coming at regular intervals, like I said before. And now we have the sawtooth P waves. So that's atrial flutter. How you treat atrial flutter? Honestly, all of these regular QRS, regular rhythm, narrow complex QRS have pretty much the same treatment. You rate control and you can cardiovert if they're unstable. So rate control, cardiovert if they're unstable. So narrow, if it's irregular, if it's coming irregularly, the first one is atrial fibrillation. Remember, irregular. And this one has no discernible P waves. That's how you know. So these are narrow complex QRS coming at irregular intervals. Remember that atria is fibrillating, so you can't really discern the P waves, and that's how you know it's atrial fibrillation. So same as always, rate control or cardiovert. And the other thing is anticoagulation. Why do we do that? Remember we said that the atria is fibrillating, so there's blood stasis in the atria, so there's clots forming and they can shoot off, and you don't want that because that's bad news. Thromboembolisms can cause a lot of bad things, we said. Next is if you have atrial flutter with variable conduction. So that's pretty much the same thing as what we saw before, but remember how the AV node is going to control what impulses can get through and what impulses cannot from the very fast atria. So this one is where the AV node is conducting variably, so it's kind of erratic too. So that's why you get an irregular QRS rhythm. Same idea as always, rate control, cardiovert. And finally, we have multifocal atrial tachycardia. Again, narrow QRS, irregular. Sorry, excuse me. You can see that this is fatter than this. And the special thing here is that you have three or more different types of P wave morphologies. You see this P wave looks different from this P wave, looks different from this P wave, actually, and looks different from this P wave. So that's multifocal atrial tachycardia. Multifocal means that you have, remember, atrial is the P wave, so multifocal is like different P wave, different atrial contractions. And so the treatment here is to treat the underlying cause. So that's it for our overview of all the tachycardias. Remember just the general approach. Look if it's wide or narrow QRS. If it's wide, it's either a ventricular etiology or it's that reentrant pathway with like the Wolff-Parkinson-White. If it is narrow, you know it's from the atria, so you want to know if it's a regular rhythm or irregular. And that's going to help you a lot. And then once you've determined that, the last thing to look at is look at the P waves. Remember, this is all atrial etiologies. So narrow, narrow QRS. Excuse me, I'm struggling with this iPad. Oh man. Narrow QRS is atrial etiology. Alright, so that, or it could be sinus tachycardia. So that's it for our review of tachycardia.